This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue
As
supposed to help first.
Medical Dilemma.
Hi, I'm Sunny Del Rosario and you're tuned in to Medical Dilemma. In Philippine culture, machismo is very much alive among males, and it comes as no surprise that erectile dysfunction is feared. Because of this fear, a lucrative industry of male performance-enhancing drugs and therapies has sprung up, albeit with little to show in the way of evident effectiveness. In this episode, we discuss how Filipino men can make that desperate last stand against erectile dysfunction. Joining me for the first segment is Dr. Eduardo Gatchalian, a urological surgeon from the Philippine General Hospital and Manila Doctors Hospital. Welcome to the show, Dr. Gatchalian.
Hi, good afternoon, Sunny. I'm very glad to be here.
Thank you so much. Now, for the first segment, we'll talk about a few basic information about your specialty. So what do you do as a urological surgeon?
Well, essentially, we deal with all conditions that has to do with the genitourinary tract of the male and anything to do with the urinary tract of the female, because, of course, the genital tract will be the gynecologist there. And then operate on such conditions if need be.
Okay, and
We
what
have
are the typical conditions that you
The typical
encounter
conditions that
in
we
your
handle will be
practice?
stones of the urinary tract. For the males, the prostate, and of course, erectile dysfunction. For the females, of course, we've got urinary tract infection, both males and females. Then we have tumors of the urinary tract.
Now, could you give us some figures as to indicate what are the most common and less common conditions that you encounter?
Well, in the Philippines, being a tropical nation, I guess 30 to 40% of our practice deals on stones of the urinary tract.
Stones of the urinary tract.
And then, when the man ages, because the Filipinos are living longer because of health, then we see more prostate patients. So I guess about another 30% will be prostate problems.
Prostate problems.
And then we've got tumors of the urinary tract from the kidneys. Again, the males have a predominance. We see about 8, with a ratio of 8 to 2. 8 males to 2
8
females.
males to 2 females. Okay.
So the prostate cancer, again, is on the rise because of environment and diet. And then lastly, of course, you've got clinical procedures like urinary tract infection, consultations for problems like erectile dysfunction or premature ejaculation. So, you know, problems with sexual problems not only is on ED but also on premature ejaculation.
Now, these common conditions you cited, are they also true for the females?
No, this is mainly a concern for the males. The
Only-
females,
yes.
of course, in our culture, takes more of a passive nature in that they respond to the advances of the males, and therefore they rely heavily on. I mean, majority will rely heavily on how the male will do his first move, and then show how machismo he is or how in demand he is, and therefore he is willing to take the woman, sweep the woman off her feet, and therefore that's how it's supposed to be in our culture. Of course, in some other cultures, especially in Western nations, the
It's
female
not the
sometimes
same.
is the more aggressive partner.
I
But in
see.
our case, slowly, of course, we're copying that, but generally it's the man who starts everything.
Okay, so focusing now on erectile dysfunction.
That's the reason why he has to be, he has to produce results. I mean, he has to show to the partner that he can actually perform.
that he can perform.
He must be able to perform.
Now, what exactly is erectile dysfunction? Are
Well-
there different types of this condition?
Yes, erectile dysfunction is not called impotence anymore because it is such a derogatory term. So we've done away with impotence. We call it ED. And my name is
Okay.
Ed, but you don't. You bet.
You
Don't call
don't
me
have
ED.
ED.
So, So it's ED, but it doesn't stand for erectile dysfunction.
Erectile dysfunction.
But to shorten this thing, let's just call it ED, okay?
Okay,
And that's
ED.
the only time I'll allow you to use the ED as a shortcut. But it stands for erectile dysfunction, which is actually the inability to maintain erection enough for sexual intercourse, sexual performance. Again, I say this in the context of a heterosexual relationship because these were a term long before the LGBT community came along.
Yes.
So it has to be in a heterosexual relationship. And if this happens more often in a 6-month period, then you are labeled as having ED. Usually, it is mild, moderate, and severe. Most of the men who will respond to medications have a mild erection. You know, when they come home from work, you're busy, you're harassed by your boss, and you are unable to perform. On the way home, the policeman catches you, gives you a ticket, and then when you park, something gets stolen or you get to scratch your car, and therefore you are not concentrating, and then when you have sex, then you most probably will not be able to perform.
Okay.
And then that's, you know, happens sometimes. That's a mild. Moderate,
Just a mild.
moderate if it happens, you know, in a week 2 times, and then 2 times in a week. I just don't know. Well, you haven't asked me how often that sexual intercourse should be, but anyway, if it happens more often, then that's moderate. You know, it takes a longer period. Your partner takes a longer time to stimulate you. You've got to have the right music, the right environment, really dim lights. You've got to have a triple X going there.
Moving on,
going there. Now, the severe ED is when, in spite of all these measures, you are unable to really get it up. And when you're about to go, suddenly it gives up on you, and then everybody's frustrated. Maybe your wife or your partner is more frustrated than you are. And that's the start of your ego deflating.
Okay, now is this connected to age?
Absolutely.
Absolutely.
There are certain factors that have been shown inexorably associated with ED. And number one is, of course, age. The older you get, I'm still young, by the way. People always look at me as an example. But there are at least 5 conditions associated, and age is always one of them.
Okay.
So the older you get, the more chance you're having ED. Number 2, of course, are the regular conditions that a man usually has when he ages, and that's the reason why. The most notorious, of course, is diabetes, which many Filipinos have, hypertension, heart disease, and of course, your smoking.
Okay.
And a sedentary lifestyle that has the hypercholesterolemia and all the lipids, etc., that are elevated in your blood. If you have all these conditions, then I can look you in the face and I can tell you that you most probably have ED.
ED. Now, assuming you don't have the other conditions except age, okay, at what age would I normally expect
Probably
ED to come
when you reach about the age of 60, then how should we call it? The organ, rather than call it the penis. The organ starts
You
stuttering.
just mentioned the penis.
Well, just so that it's very clear, the organ,
Okay.
because we usually call it, you know, in the vernacular, si Pedro or whatever it is, but here we call it the organ, starts stuttering. That means he's not as rigid and erect. A rigid and erect erection is supposed to be stony hard. I mean, if you hit somebody with it, that person is going to develop a hematoma because it's really, it's going to be hard. It's going to
That
be
hard,
really
yes,
hard.
that hard.
And therefore, the woman is going to feel it because that's the more enjoyable aspect when they really feel that it's really rock hard. In fact, if something happens to the penis while they're having sex and you injure the penis, they call it, just like you would call it when the bone gets destroyed, or you call it a penile fracture because it is so hard, like a bone, and therefore if it gets injured, you call it a penile fracture. That's why it's that hard. And that is how you grade your erection. If it is rock hard, bone hard, then you know that you've got a grade 4 erection.
How do you physically or visually evaluate, you know, the levels of hardness?
Well, if you are able to insert it easily, you know, in I don't know. I hope everybody who's watching are all in the mature and adult age group, because of course children may not understand it, and we might be driven off the off by the sensors. So the rock hard is when you easily insert it. Well lubricated, you can easily insert it. There's not going to be a problem. On the contrary, the one that is as soft as a gelatin or a sponge will be something that will never be able to enter the female's organ. Because remember, this is a heterosexual encounter. And the one wherein you are able to insert it only at the middle and then dies off, that's the second stage. The one wherein you are able to insert, but it's not hard enough so that pretty soon it dies out on you, that is the third part.
I see.
So what we want to achieve is something that with a grade 3 or grade 4 hardness, enough for you to complete a sexual encounter. And that will depend on your partner. Because women will take a long time for them to reach orgasm. If they don't reach orgasm, you're in a bad situation. She's going to slap your head. And, oh, come on, I haven't finished. I haven't enjoyed it yet. And therefore, you're not going to enjoy it as well. And that's the reason why it takes a certain performer in the man. That means he is able to last, he is resilient, and able to last as long as the woman. Because if he ejaculates soon enough, automatically, physiologically, you lose your erection.
I see. Okay.
So after ejaculation in a man, 100% the man will
We'll
lose his erection because that penis has to rest. That's what we call a detumescence. So everybody goes a detumescence. And there is a refractory period. Now we're going to before he gets another erection. And depending on your age, it can last from 15 minutes to 30 minutes to 10 days to
10 days.
15 days to 1 month to a year. Probably the 70-year-old, his refractory period will take about a year. No, about a month.
About a
So
month.
it depends on what your age is, what your physical stamina is. I always tell them, erection is a reflection of how healthy you are. Because for you to have an erection, your nervous system must be intact. Your vascular system has to be very good. That means there is a good flow. And that's the reason why you have hypertension, hypercholesterolemia. You've got a lot of plaques in the blood vessels. Most probably, you are the best candidate to have an ED.
Because it constricts the flow of the blood.
It blocks the flow of blood into the penis. The penis is the biggest acceptor of the blood when you have an erection. In fact, those who claim to have a big organ, like the Arabians, claim that they develop hypotension because all their blood goes to the penis and that means
and there's
nothing's
nothing
left
left
in
in
the
the
body.
brain.
So that's, but siyempre, ano na lang yun, yabang na lang yun. But it is always the blood. And the blood that is maintained there, that is the one that will maintain the erection.
I see.
Now, when do you lose your erection? After you ejaculate. But you must not lose the erection before you ejaculate.
Before you ejaculate.
When you lose your erection before you ejaculate, then that's what you call one grade 2 or grade 3 ED.
ED.
And we would like to prevent that from happening. Because a wholesome relationship between the man, woman, and husband, wife, partners, whatever you call it, is predicated on the requirement that they must be able to perform enough to satisfy the partner. That's the reason why its definition is to be able to have a successful performance of sex. Now, it depends on your partner. How do you satisfy your partner? There are so many ways, of course. And there is the hand, there is the tongue, there's the mouth, plenty. But generally, we rely heavily on the male organ to be able to deliver that performance and satisfaction to please the partner. Because man and woman is a sexual being.
Okay, Dr. Gatchalian, we'll have to hold that point. We'll take a
I'm
commercial
just
break. No, we'll just take
I'm
a
just
commercial
getting
break. And we'll be right back after a few words from our sponsors.
Okay.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?